Hello, good evening. I'm Dr. Dasrath Kafle, and she's my wife.
I'm Dr. Nisha Acharya. I'm an endodontist and a restorative dentist. I work at Institute of Medicine at Kathmandu. Um, Abdarshan.
And I'm orthodontist. I'm professor at Kathmandu University School of Medical Sciences. And today we are going to show you our private practice.
This is a place where we work in the evening after our medical school. The name of this clinic is Braces and Faces Dental Clinic. So, welcome to our clinic. Let's have a look.
Okay, thank you so much. Let's have a look inside your. We can start from the waiting area.
Sure.
Yeah, I give you a brief background about the clinic. Actually, this is our own house, though we don't live here. So we started our practice after COVID. We had other practice, but we don't work. We mainly work here now. It is a very small practice, very modest. We don't have so many hi-fi things, but we are trying to make it very comfortable for Nisha and myself and for our patients. And waiting room is a small waiting room, but we are trying to make it comfortable for the patient as well as comfortable for the assistants to clean it so that they can move every part and go to every corner for cleaning. And
Sorry to interrupt.
yes, please.
And we have one more small waiting upstairs when we have too many
Upstairs,
patients
that's
here. So we'll show that later on.
All right, so I have this Bangladeshi corner. You can see souvenirs from Bangladesh. This is also a souvenir, small souvenir my colleagues gave me from Bangladesh. I really love and miss Bangladesh. I got my education from Dhaka Dental College, so Bangladesh is my second home. I really admire that. And going to the practice now, please come, Atique. So basically, we are. This is a one unit, and I have another unit on that side, and we have two other units in the upper floor. Basically, we work here. So you can see we have a portable X-ray and computer. We work on a software which makes our life a little bit easier to keep the patient record and appointments also, and we write the notes on the software as well. And
Everything is digital.
we are trying to make it digital now. Mainly workflow, we are trying to make it digital. I will show you how we set up 3D printer upstairs also. Mainly Dr. Nisha is doing endo works there with rotary endodontics and loops also. And we have restorative materials, little bit unorganized, sorry for this, but it's the end of the day. Then we can go inside here.
Okay. There is another unit.
Yeah.
It is separated by a facial wall and a glass door.
Yes, yes,
Okay.
yes. Here, this is mainly orthodontic part, and basically we have all the orthodontic supplies here. But however, it is stored here. Main part is all the pliers and instruments. They are autoclaved and stored here. I try to, autoclave and bring it here and again go to the sterilization, so that I try to keep as many instruments as possible.
You have a scanner here.
Yeah, I have a intraoral scanner. This I am using for last 3 years, and this is one of the great tool I have for my practice because I don't need to take any physical impression. Another thing is I can store this data in my Gmail or in the cloud, so that whenever I need, I can show it to the patient. Even I can show it in my mobile. So that is good. Then I design aligners also in house.
Okay, I have one question. In some clinic, I have seen that they kept their cabinet in the other side of the doctor.
Right.
And
right.
in this clinic, I'm seeing in this room you have the cabinet in the doctor's side,
Right.
and in that room you have that cabinet on other side of the.
Exactly. So in orthodontics, basically, assistant know what we are going to do. In this patient, they check in the software what we are doing. Normally, at the end of the day, I will always write the plan for next visit, so that they don't get confused. My room is a little bit small, so I want to make it more convenient for the assistant also. So I'm going to change the wire. They will pick the wire and bring it here, and they will already prepare the instrument here so that they don't need to go there. If I have a bonding, they prepare everything here. So it's already pre-planned so that assistant doesn't need to open the drawers. If sometime needed, there is always our second assistant waiting in between the two rooms. She always assists us. That's the reason it is on this side.
And I think this might be another advantage of keeping this room side by side. One assistant can help both the rooms.
Yes, we basically try to do six-hand dentistry, but the sixth hand will be on that side and this side. I have assistant here and myself. If needed, then third assistant can work in between two units.
Okay. We are going upstairs.
So with time, we had some increase in patient flow, so we thought of expanding our practice in another room.
This is another waiting room.
Alright, so we have two other units in this room. This is the waiting room, and I have a small store room here, so I store everything here. So it's a little bit spacious room. Initially, I plan to do some surgical cases and implant cases. I do implant cases, but surgical cases we do down. Apart from that, we do in-house aligner here. So I can show you the 3D printer we have. We have a small 3D printer here installed. So once I take the scan, I design and send the file to the printer, and we can print and thermoform here. Alright, apart from that, we have separate X-ray here so that we don't need to transport the sensor. So we already installed the sensor here. Basically, I try to, when I have many patients, I try to move all these four chairs. I try to move in between the four chairs, and I have the assistant who help me to change the modules, and once I do the bonding, they do the cleaning for me. So I try to use these units also.
Okay. One thing I have noticed that you have put different colors in different walls.
Yeah.
So is there any thoughts behind this?
Not really, but I just wanted to make the clinic a little bit, warm, so that, I have mixed different colors, in down floor and this floor also. The only idea is not to make it monotonous for the patient, just to give little bit of mood elevation for the patient. That's all. Yeah.
Wonderful idea.
Yeah. And maybe I can show you how the doctors and assistant can be connected down. Patient come from that area, but we doctors and assistant can come through a small channel I have created. Sorry for still need to be done here.
So this is the
backyard of the. Another thing is I have kept the suction outside so that I don't have any noise inside, and I have done same thing on the lower floor also. We have kept whole suction outside, so we can do mainly noiseless dentistry inside.
Okay.
Please come.
This is very important.
This is very, very important. I really, nowadays, I can't work with sound, is our suctions are outside, and once we close the door, it is really quiet.
Yes. And even in some clinic I have seen they put the compressor just beside the dental unit which is also very, I think it's dangerous also.
It's really dangerous and it's disturbing, and at the end when we work for 10, 15, 20 years, there might be problem in the ears. So compressor we can always put outside. I'll show you how we have kept the compressor down also, and we can bring with the pipe and that very easily.
Okay,
Right.
just see.
तपाईले खाना अर्डर गरेको थियो
हो उहाँहरूलाई
त्यही भन्छु म
Okay.
let's go down. It's a little bit messy, I think.
Area, I think.
Yeah, this is a sterilization area. So we have a big glass autoclave, and then we have distiller basically, and we have autoclave pouch packing area. Needs to be a little bit, more revised. Yeah. And we have cabinets, and these days we are mainly doing on the softwares, but still we have to keep the physical records of the patient. So these are physical records. Let's go out. What do you think?
ए भन्दिनु त यी चाहिँ रेकर्ड गरिदिनु लाग्यो मैले 560 रुपीस भयो
560.
म गरिदिन्छु
This your
Have our momo.
That's the momo, yeah. That's your momo.
So bad.
Sea momo.
See momo.
Sea is a chili, and this is a special kind of momo. As you are in Nepal, you must have tried momo, but this is very special momo.
Thank you so much for the momo.
My pleasure. We will try momo also.
यिनीहरुलाई पठाइदिनु न है
এই আপনি
গোবিন্দ
খুব ভালো
চৌধুরী
বাংলা বলেন, একটু বাংলা বলেন না শুনি।
এখন আমি আতিকের জন্য মোমো অর্ডার করেছি। This is a very special momo from nearby restaurant.
It's Bangla. I'll say something.
ওকে,
ভালো ছে
ভালো
ভালো ছে
ভালো আছে?
ভালো আছে।
ভালো ছে that's all I know.
So this is
বাংলা ভাইয়া।
acha. It is sea momo. This is fried, little bit fried, and lot of chilies and very spicy soup on it. And when you eat, then you taste the momo at the same time. Being Bengali, you might like the spices.
Bangla.
জাল বেশি আসে। Okay.
ভাই আপনার মানে বাংলাদেশি প্রিয় সিঙ্গারকে?
জেমস হাসান, আয়ুব বচ্চু।
He sings in
কোন
Bangla too.
কোন গান, একটা গান শুনতে চাই।
এই রূপলি গিটার নিয়ে একদিন চলে যাব দূরে, বহু দূরে, তারপরে আসবে না।
আরেকটা গান শুনছিলাম,
কোথায় আছে, কেমন আছে মা, 9 মাস কি ছিল,
10 মাস 10
10 মাস 10 দিন গর্ভে, something. It's very nice.
Wonderful, wonderful.
Thank you.
Thank you so much.
So